I am having a McDelivery. Ooh, hot fries, hot fries. Take a few drinks of the vanilla shake. I meant for this to be my dessert. I didn't get any pies or anything.
Picture yourself in a Vegas apartment, 2 whole McChickens and piping hot fries. You look in the bag for more saucy sauces and discover there's no apple pie. Candy in the video with no pies. Boop, boop. Hi guys, how are you doing today? My name is Kidneyjay. The J stands for jerk because my kidneys are a pair of jerks. And that was, of course, old Lucy in the Sky with Diamonds, ruined and parodied by me, but originally sang by the Beatles. We are going to get into this candy video. Now, that song was just a little bit of levity because we are going to get into some serious hate that Candy receives in her inbox. We're going to talk about Candy embarking on a new health journey and what the highs and lows were for her the last week. And it seems that she had an emergency therapy session. But before I get into all that, you guys know what I'm going to invite you to do. Please dip your nuggie into my subscribe button. Appreciate that. Like if you want. Don't like if you don't want. As well, I invite you to leave a comment down below. Love learning from you, love hearing from you. And I do have memberships if you want to help my humble little channel that way. And I just noticed a little sideways squirt there of mayo. Oh boy. And the package lick. Anyways, yeah, let's get to this all. So first, we're going to start off with Candy's most recent community tab. So Candy posted this today, Sunday, August 25th, and says, "How would you feel if you woke up to this kind of crap every day? When I think about haters, this is the kind of hate I'm talking about." And listen, I am just going to scroll through it. I'm not going to say what these people are saying. You can go and look. It's on Candy's community tab. But I honestly don't get this. Why would you put that kind of hate out into the world? Listen, you don't like Candy. You think she's killing herself, well, unaliving herself by eating this kind of food. Fine. She knows it too. Why? So that's all I'm going to say about that. And in other community tab news, Candy missed an upload on Wednesday, and as Candy usually does, she puts some sort of community tab up. Sometimes it's ambiguous, sometimes it's just, here, I don't feel well. This time it was a 9 Inch Nails song, but that didn't interest me. What interested me was a comment down below where she says she actually had to have an emergency therapy session. Now, she just started therapy 2 weeks ago, so if that session was an emergency one, maybe she had 3 sessions in total, maybe 2, I'm not sure. But I digress. That 9 Inch Nails song was called The Great Below, and the lyrics were rather dark, to say the least. So someone commented this. If this, I think they meant, if this is a cry for help, ... reach out. If it is just a lazy FU, then shame on me for caring. So Candy wrote back, "I have an emergency therapy session today. It's just a day. There will be others." Talking about it's just a day I missed uploading. There will be others. But the problem with ambiguity is people will perceive it a certain way, and they will think you are kind of baiting your audience into being worried about you. So I don't know, just some advice to Candy. Just, if you're not going to upload, just say, "Hey, I'm not going to upload today." I don't know. Maybe, obviously, dramatics get you clicks and views. So with that being said, let's get into what she has to say during this mukbang about her her venture into new health and what happened last week that sent Candy spiraling.
So I've had a hell of a week. I mean, it's no big deal. But I had these high hopes of finding a doctor and all that stuff. I don't know, people are like, why bother? Indeed, why bother? It's not like it's going to do me any damn good anyway. Because I'm fat and I'm going to die fat.
Looks like she had already been reading those emails, maybe. But you guys know I'm a hopeful little bean. I don't think it's ever too late for anyone.
Just the way it goes. Anyway, I mean, I made some phone calls. And apparently with the insurance that I have, that I pay a premium for, mind you, and without a tax, like, write-off for it or whatever, you got like a tax credit. That's what they called it, tax credit. Without the tax credit, I'd be paying like $500 a month for this freaking insurance. And all the places that I wanted to go to or to try for, they're like, sorry, we don't take your insurance.
So $500 a month would be what, $6,000 a year? I know that's something I cannot afford. I also know that people are going to comment that she can afford to eat this fast food, but not afford to put in the money for her own health care. But it's not as cut and dry as that, because Candy has landed herself into a cycle of eating to earn money, which makes her unhealthy. Yeah, just a messy, messy cycle.
I was like, okay, that sucks. So, I don't know. The first part of the week, I got burnt out on making phone calls, so I'll try again next week. So Monday, I'm gonna go ahead and get on the phone with my insurance company and just ask. I mean, they might not know, they might not, whatever, but at least try and see if they have any physicians in their network that do house calls. They probably don't. Or they just don't know. They do have virtual visits available that there's actually no charge for, so that's for like certain things, like certain like bladder infections and things like that.
Which is how Candy has been managing her health so far, has been doing virtual visits. She did admit that she was almost getting cellulitis infections weekly at one point, and she would call, I guess, Sesame Health and get an antibiotic.
I know they had like a list of stuff that they can cover, but I need an actual primary care physician. So goody me, I'm gonna have to leave my apartment and my medical care. And I don't know, man. Was it Tuesday? You know, after like another barrage of phone calls, I just fell out. I mean, I just full on had a panic attack, like hyperventilating, you know. Just, it was ugly.
Okay, so that's where we are. Honestly, I can't remember the last time Candy left the house. That's not true. I do remember. I don't remember the date. Maybe it was 2 years ago, but it was indeed for medical intervention. She ended up in the ER with an infection, needed antibiotics, did a video about it, but it looks like she had a meltdown because she was not getting the results she wanted with the effort she put in with the phone calls, and that's where the emergency therapy session came in. So we'll see where we end up next week. Like she said, she's going to try Monday, try again. Please get a primary care physician, Candy, first and foremost, so you can have that continuity of care. And they know your medical history, they know your boundaries, everything, all that good stuff. Anyways, thank you guys if you made it this far. Appreciate all of you, and enjoy your day and your week.